issues. And stop pushing wheel. That's no excuse. Closed captioning provided by. For people living with HIV, keep being you. And ask your doctor about Biktarvy. Biktarvy is a complete one pill, once a day treatment used for HIV.
Touch has been cleaned and sanitized. We'd like to offer boarding at this time to anybody who might need a little extra time for additional assistance.
Research.
You want this? Make sure you're on mute. You want these?
The CPSC has
Her mother was into.
Hello.
Hello. Hello.
Hello. I didn't know what time the meeting started. I had two different times, 6:30 and 6. Do you know what time it's officially starting?
It says 6.
Okay.
service going and made it better through.
But I think you're taking a little bit of advantage of the situation.
Are you gonna get some of them done right away?
Yes, absolutely.
Governor Charlie Baker said he brought long-term stability to the team when it was sorely needed. And under his leadership, the MBTA has upgraded more infrastructure vehicles than during any prior period. Adding Steve and his team have continued to build a better T every day. Some say
Hi, everyone. We'll be getting started here in a few minutes.
Hello, everyone. This is Christine Pa from Franklin Park Coalition, and we're just waiting for our board president and facilitator to jump on. He had a little Zoom trouble, but he'll be here in a minute. So give us a few minutes and we'll get started right away.
Hello, Christine. Hello.
Hi, Ricky. We can hear you.
Okay.
Christine, do you want to kick us off?
I'm sorry, what did you say?
Christine, Pop.
Yes,
Can you hear me? No,
yes, what did you say?
no, Christine.
Great. Ricky, you're on. Should we get started?
Yes.
Sure, please. Yeah. Okay, good evening and thank you for coming on to this call tonight.
and coming out to spend your time. Christine, would you like to introduce yourself? I'm Ricky Thompson, President of Franklin Park Coalition, and Christine Paul.
Ricky, somehow you're muted.
Christine, we can
Oh, we
hear.
can't hear you.
You're not hearing us.
Yeah, because I thought I just went. Yeah.
Hold on, I'll just give her a call and let her know.
Okay,
Ricky,
okay.
you keep
All right,
going.
So we'll move on.
Yeah, we can hear him.
Yeah, we're here tonight because Jean McGuire, a longtime Roxbury Community and Park member, was brutally attacked a few weeks ago, as most of you know, while she was out walking her dog for a nightly walk that she's done for probably close to 50 years in safety near White Stadium. We're also here because there's been an uptick in drug activity near the Shattuck Picnic Grove and the William Street entrance. So thank you for coming out again and giving your time to this important issue that we're trying to find some solutions to and trying to hear your input and your suggestions. Christine? Still muted. Excuse me.
Unmute yourself, Christine.
Okay, I'm the one having technical difficulties, sorry. My name is Christine Pop, and I was the director of the Franklin Park Coalition for about 15 years and have come back in the last year or two to help out and support the coalition and get involved. And so I have a little bit of history to share. You know, the Franklin Park Coalition has sought increased public safety and quality of life improvements since its founding in the 1970s. The most recent was to address motorbikes and loud music, but it's often been to advocate for a greater park ranger and police presence and more call boxes and lighting. And some of you may remember that 15, 18 years ago, we fought when the park rangers were going to be eliminated completely from the park budget. And today they're still a thriving force, which is really important for Franklin Park. We hope that our public officials here tonight will commit to helping us make the park safer and offer some of their ideas and strategies. I'll turn it back to Ricky.
Okay, tonight we have elected officials with us tonight in community groups. State Rep Liz Miranda from Dorchester, who has just been elected senator, and we congratulate her. She was out at the park walking with us yesterday to investigate this situation about the uptick in the drug use in that end of the park over by Shattuck. I'm not sure if she's on the line, but she was here yesterday, and she definitely has given us her support in this issue. We also have San Montana from Jamaica Plain, soon to be state rep, District 6 City Councilor Kendra Lara. We also have community associations represented around the park, Garrison Trotter Neighborhood Association, Stony Brook Neighborhood Association, Eggleston Square Neighborhood Association, Mattapan Council, Jamaica Plain Neighborhood Association, and the Franklin Park Tennis Association. This list of who's who tonight shows the complexity of the park and the concern for the issues that we have here. So many people are reaching out from different neighborhoods. We appreciate all of you that are here. And also we want to hear your concerns and bring your ideas and strategies to keep our park safe. Christine?
So here's how we're going to run the meeting tonight. There are 300 people who signed up, and there are already 135 online with us. So what we're going to do is we're going to keep everyone on mute. Please raise your hand to speak or put any questions and comments into the chat box, especially if there are questions as some of our city and state officials are speaking. We'll try to recognize those. And we ask, of course, that everyone remain respectful. These are important issues and we all have a lot of concerns, but we all want the same thing. We want a safe, well-maintained, beautiful park where everyone feels welcome. We all know that the challenge of addiction, homelessness, and violence in our community will not be solved overnight. These are really complicated issues. And we want to remind everyone that addiction and violence have touched many of us online tonight. We ask you to be compassionate towards our fellow community members who may be struggling or have family members who are struggling. And we at Franklin Park Coalition are working alongside our public officials and community members to address these problems. We hope very much that tonight will create a new partnership to address issues together. FPC has long believed that Franklin Park can be the site of large celebrations, healing activities, many different types of park uses, but with appropriate management. And that's what we hope will come out of our advocacy work for a safer park. Management strategies to make sure that everyone feels safe in the park. So here's how our agenda is going to go. We're going to start with city and state officials who are here with us. And after we hear from these representatives, we'll open it up for community comment and questions. I also want to say from the outset that this meeting is about current public safety issues. It's not about the proposed Shattuck redevelopment project. There will be many opportunities going forward to offer input and discuss that project down the road, but we want to really focus on the immediate issues tonight. And thinking about any questions and concerns you may want to have as you're listening to our public officials speak, please plan to keep it brief, no more than a minute, to give others an opportunity to speak. And if you have a question, we'll direct it to the relevant public official. We also really want to hear when we open it up to all of you, we want to hear whether you feel safe in the park and what would make you feel safer. What are your suggestions and ideas? We want to really think forward and have our public officials hear what we think would make us feel safer. So back to Ricky.
Yeah, we had hoped to have with us the Boston Police report from B2 that covers the entire park. The community service officer is covering another meeting and will join us later. However, I believe we do have the report, Christine.
We do.
You have a copy of the report?
Yeah, and I'll share that when he comes on.
Okay, so we will begin with city and state agency representatives who will share their practices and how they are operating in the park and on the Shattuck campus. City and state agencies and representatives, including Ryan Woods, who's our Boston Parks Commissioner, who works closely with Franklin Park Coalition and has been aligned with us in regards to everything related to the park. We really appreciate his engagement. And I want to thank Leo Bauscher from the Parks Department, Parks Maintenance Supervisor, who has walked in the park with us and made sure that the trash and encampments get cleaned up. So Ryan, if you're with us. Is Ryan on?
Uh-oh, maybe he's not on yet. He said he would be. Yeah, he is on.
Okay.
Thanks. I was waiting for the permission to unmute. Thank you.
Okay.
Good afternoon, everyone. Good evening, I should say. My name is Ryan Woods. I've been with the Parks Department for the past 16 years, in the capacity of the commissioner for the past 3. And I've enjoyed having a close relationship with the coalition. Everything from summer programming and partnerships, through repairs, through the recent Franklin Park Trust that we worked through, the money that came from the sale of Winthrop Square Garage, and how to implement improvements in the park. My staff and I have had the opportunity in the last couple of weeks to walk the park several different times with the coalition, with the senator-elect, as well as with the public safety officials and the crisis response team, coordinated response team, excuse me, from the mayor's office that deals with a lot of issues, whether it be encampments throughout the city, opioids, et cetera. So just want to talk to you a little about what we've been finding. Lately, we've been seeing some tents pop up in the park at various locations in the park. Upwards of 10 to 12 some days, other days a handful, and tucked in all different crevices, whether it's in the wilderness or more wide open areas, by Ellicott Dale that you can see, but we've seen it. We see the remnants left behind. We are working in partnership with the coordinated response team, where we call in for support services first to engage that comes in. So the response team comes in with Boston Police. trying to get people into services and see what kind of services can be helpful to them. After that, they're encouraged to move on. Once they leave, and we come in and pick up whatever's left behind. Our maintenance team is in contact with the CSO in every district throughout the city because we have this issue going on in many parks throughout the city. So we have a touch point with them when we go back, if anyone is in these encampments, so we can remove whatever remnants there and get them out of the park. We don't allow tents in parks unless they're permitted for some sort of a special event. So anytime a tent is popped up, if you'd please let us know. 311 is the best way going forward to put things so we're aware of them and we're able to respond to them in that way. The park rangers are walking through that park on a daily basis. They do cover just the Emerald Necklace. So they've been spending a lot of time walking in areas that we know as quote unquote hotspots to check in and see what's there, engage and report back to us and get that additional help that's there. So we're here to listen. We want to make improvements. We want to hear what's going to continue to make people feel safe in the park and welcomed in the park. So we're open to that. I know my chief's on the line. I don't know if someone can unmute her, but we have Reverend Mariama White Hammond with us as well, who's the Chief of Energy, Environment, and Open Space of the City of Boston, who's very engaged in this matter as well. So if I'm able to pass it off to the chief, that would be great.
You should be able to speak, Mariama.
Yeah, no, I think Ryan covered very clearly what we're doing. I want to thank the coalition. As you know, I've been a part when I was a resident, and looking forward to the turkey trot, but want to make sure that we do everything we need to do in these next couple of weeks as things get colder to still make sure that the park is safe. As some of you know, I haven't been running since I broke my ankle, but I think the wilderness area is a particular concern because I just think that people don't expect to come upon folks sort of living there. So, I've heard from folks, including folks in my family, about the concerns, and we're just, sort of here to hear if there are other things that we could be doing in addition to the things that are already happening. And also I know that there are, I think, folks from the state here, so wanting us to figure out how that coordination can be stronger.
Thanks.
Okay, I think we have Tania from the mayor's office. I believe it is. Tanya.
We also do have.
And also we have a
Sullivan
District 7
from
counselor as
B.
well, I believe is on.
We also do have B2 on, by the way.
Yeah, what I think
Okay.
we'll do is we had B2, Bernadette, we will have you come on after Tanya and before our state officials. If you can hold on a few minutes.
Okay, so why don't we have Tanya come on now?
Great.
Thank you. Excuse my voice. I do have a bad cold, but I'm really happy to be here to explain a little bit more on the operations side, how we respond citywide to encampments and how we provide services to people that find themselves staying outside. So my name is Tanya Del Rio. I direct the coordinated response team out of the mayor's office. It does respond citywide to encampments that form, and as soon as we are notified of an encampment, whether it be by a resident, the 311 request, super important. I just want to emphasize what Commissioner Woods just said about 311 being a key tool for our team. As soon as an encampment is spotted via 311, that is how we first hear of it, and our team activates our protocol. We also we also are able to receive some of those notifications via elected officials, so you can contact your city councilors or your elected representatives to let them know when you spot something, and they can let our team know as well. And obviously we have a presence 24/7 in the park through our rangers and through BPD. B2 will speak a little more about this. So we're constantly present, and Franklin Park is an area that's become more priority for our team. I just wanted to kind of step back and tell you that the coordinated response team does involve 12 different city departments that respond in one way or another. when it comes to responding in Franklin Park, we're most usually working with the Parks Department and the Police Department. And we have two types of protocols that we will apply as soon as we get the notification via any channel. We have our standard protocol and our immediate protocol. Our immediate protocol is what we're using in parks, schools, or other settings where there's an imminent risk, and we need to resolve the encampment as soon as possible. So we normally will try to do that within a day, at the latest a couple of days, if it's a park, school, or other imminent risk situation. And our response includes a couple of components. First is outreach. We will either through city staff or through partner agencies like Pine Street Inn and others, reach out to the people who are staying outside and offer shelter, offer different services, whatever it is they may need. We try to get to know them and find out what it is that they're in need of. A lot of the times people accept services and we're able to resolve really easily and connect them with shelter. A lot of times people, for many reasons, refuse those services, and they have the right to do that. When that happens, and they refuse to voluntarily depart from a site where they're not allowed to be staying, then we go ahead and do a posting, what's called a posting. We involve the inspectional services department, and the reason we do that is because, the city has determined that staying in a tent, staying outside, is just not dignified kind of human living. It presents a lot of health and safety risks, both for the person and for the actual public at large. And so we try as much as we can to convince the person to receive services. When that doesn't happen and the city determines that there's an imminent risk, we do go ahead with the protocol. We post the site. We offer storage for the person's belongings. Just a reminder for everyone that we do have a constitutional right to our property, so the city never confiscates anyone's personal belongings, but we do offer storage if they're willing to use it. And if not, the person might just move along after we enlist BPD support. I will say 99.9% of the time, I've only been in this role since June, but my predecessor can confirm that we have to this point barely taken that step of enforcement. Most times encampments will resolve via voluntary compliance. And then we enlist either our public works, our parks, or our property owners support, depending on the type of property in the park. Obviously, it would be the Parks Department to clean up any remaining debris. What I'll say about Franklin is that, and our park rangers can probably confirm that this becomes an ongoing process, right? We'll resolve an encampment, the person will agree to move along, but most often might come back to a different spot or the same spot in a couple of days, and we just kind of implement the protocol again. It's a delicate balance between public health and public safety, but yeah, you'd be surprised. Sometimes people refuse services maybe 5, 6, 10 times, and then on the 11th time they'll accept services. So that's just the nature of the challenges that individuals are facing, whether it be their mental health, their substance use. That's the nature of the challenges that they're going through. And we try to make sure we're balancing that response so that the person is taken care of, but also the public at large, and in our public rights of ways and parks, so that they're safe for all to use. As Christine, you shared, that vision that you shared of the park being a comfortable, safe space for all to use is exactly what we're going after with implementation of this protocol. And I just want to shout out all the teams that are part of the response. We are all stretched thin, but people time and time again kind of leave their daily duties to come and support these encampment resolutions. So I'll stop there, answer any questions when they arise after my colleagues speak, and I appreciate the space and the opportunity to share a little more and receive feedback.
Great.
Yes, we also want to recognize that our District 7 Councilor, Tanya Fernandez Anderson, is on, and also Councilor at Large, Rusi Lejeune, I guess it is also on the line. Now we'll move to the Shattuck programs.
Well, actually, Ricky, let's, because we have Sergeant Bernadette Sullivan here from B2, Sergeant.
Okay, let's get the report. Yeah.
Yeah, are you ready to do a report on policing?
Yes, so my name is Sergeant Bernadette Sullivan. I am the Community Service Sergeant in District B2. And I have a couple of reports here. One has to do with just the general area around the park. But I think that you're more interested in the actual park. And in the actual park, there's, since the beginning of October, there's been 2 incidents. One, I believe, is the one that we are all familiar with, which was the situation with the Miss Jean McGuire. And I think that it was actually maybe in September. But we had a motor vehicle accident at 1 Franklin Park Road. And we had a larceny from a motor vehicle on October 15th. And that's it for the month of October. What we have since the beginning of January is and this is in the park area. We have had 3 robberies, 30 aggravated assaults, 6 residential burglaries. So you can tell that's like in the area. And 22 other larcenies and 13 larcenies for motor vehicles, 10 vehicle thefts. Once again, this is the area. So total there's 84 crimes, and it's down 30% from last year. Inside the park, we have had 9 crimes. 4 aggravated assaults, 2 larcenies, 3 larceny for motor vehicles. And that's it. 4, 5, yeah, that's it. So in the actual park, it doesn't seem to be a lot of crime that's being reported. At least to the Boston Police Department. Maybe it's being reported to the State Police Department, maybe it's being reported to the park rangers, but what's actually being reported to the Boston Police Department is not much. I think that based on some of the recent events, there's more of a concern of crime, and of course, we all want to prevent crime. So there's been a regular police presence in the park, I think Thursday through Sunday, for the low riders and the scooters and the mopeds. And we have increased patrols. We call them code 19. So it's just a regular, it's just a vehicle that, you know, sits and gets out of the car and walks around, make sure that everything is okay. We've increased patrols since the situation with Miss McGuire. And when we can, we have the bicycle unit go through as well. The bicycle units is actually a citywide unit, so they have a lot of other places to be, including downtown and the common. So that is pretty much what I have. Any questions?
I think what's really important is that this message is that it is a really safe park. Things happen and that's problematic, but for the most part, it is safe. We have a couple questions in the chat that we may be able to refer to, if you could say on Sergeant. One thing, have there been, Abraham Landau is asking, how many calls have been for the big sound parties? Do you have any idea?
So it's very difficult to say how many calls have been for parties, because there are two types of ways that party calls come in. One is through the 911 method, and the other is through a party line. When calls are made to the party line, they're not information about who's calling is not taken, which is why a lot of people prefer to do it that way. And on this list of calls, there's no calls for parties on it. It's not on the January through October, because those are part 1 crimes and that wouldn't be on it. But the stats that you have here, there are no party calls.
Okay.
Okay.
Yeah, and another question is there any correlation between that Jackie Bishop is asking, between the uptick in crime and large events in Franklin Park?
So some of the, in order to know that, you would have to know when the events took place and when the crimes happened. Based on the part 1 crime information that I gave with the aggravated assaults, I would say that some of those probably did happen during events. Just because that's often when they happen and they're reported in that way. But there's, I can't recall off the top of my head what was going on in October. I think there were a couple of events in White Stadium, and maybe there was a jazz festival. And without those dates, I couldn't correlate those to any assaults here. But if you know the dates, you could certainly take that report.
The Jazz Festival was September 17th.
Yeah.
September 17th. Yeah, I don't have those stats here. These are just stats for October.
Okay, great. And then Louis, you have your hand raised. Can you put a question into the chat box? And then we'll open it up later.
There is a question about when you're saying crime in the area, there's a question about, how the area is defined, like what is the area of the park?
Well, the area that I was told these stats encompass, it includes areas like Glenside Ave and Forest Hill Street. So it would be both sides of the park, the District 13 side, the District 2 side, and is there 18? No, what's the other district that's there? Yeah, it's District 18. So it would encompass all of those, which actually means that there truly is not a lot of crime in that park. And I know that's not comforting. To say that crime is down and to say there's not a lot of crime is not comforting to anybody who's a victim of crime. So I do understand that.
Yeah. I do know that the Chief Park Ranger, Gene Servillo, has just joined, and he can answer some of the questions in the chat about when the park rangers are patrolling Franklin Park and if they're in the areas around where Gene McGuire was attacked. Chief Gene, are you on? Can you get on?
Sorry, Christine, what's the name? So I can.
He's not. He's under a phone number, and I don't know your phone number, Gene. If that's it, I'm asking you to unmute. I don't know that we. Yep, I'm asking him to, but I'm not getting it. It's 438. Can you do that, Mike? Unmute.
Yeah.
Sorry, everyone. It's hard to manage with this many people. And
I'm clicking the ask to unmute, but
me too. Chief Gene Servillo, can you unmute yourself and come on? Or Ryan, can you send him a text?
if it's on the phone, it might be a different process. You probably have to do like a star pound combination unmute. I'm not sure.
I don't know.
Or maybe we could just move
We'll
on.
have to
and
go back
if
to
it comes on,
talk.
then we can go back. Yeah.
Great.
Yeah.
So let's
Well,
move
thank you for that report. It seems that the park is safe as we thought, but we have to be vigilant. We want to keep it that way. And we need to make sure that unfortunate accidents like the one that just happened don't happen. So now we're going to move on to the programs at the Shattuck. We've asked them to share background on the people they serve, the policies, the rules related to the residents programs, and their understanding of how their clients are using the park. So the first one is Josh Cuddy, who works he's the Executive Office of Human Services and has been a liaison to the addiction and low threshold housing in New Cottages. If you're on, Gene.
Josh, Ricky,
Josh.
I'm here. Thank you so much for the invite to join you all tonight. And I really appreciate Ricky, Christine, Mike, and the larger Franklin Park Coalition's partnership and neighborliness for our programming. I'm going to give a quick overview of the cottages program, our staffing model and approach, and then turn it over to my colleagues, Ray Murray and Rita Chapladine, to speak to the Pine Street programs, and then my colleague, Justin Douglas, the CEO of the hospital, to speak to the hospital. Since starting the cottage program in late December, we've implemented a model that includes a 24/7 service staffing that has on-site nursing 24 hours a day, recovery coaching 16 hours a day, on-site mental health care, on-site psychiatric PCP care, and linkages to medication-assisted treatment. In addition to that, to best serve the residents of the program, the hospital, and larger Franklin Park community, we've included 24/7 security coverage. There's one guard monitoring the front entrance of the cottage community, as well as an internal guard conducting safety rounds and managing internal safety within the community. The individuals we've been serving have been referred through Elliott Human Services in partnership with the City of Boston. They're individuals that previously resided on shelter in the area of Mass and Cass. To give sort of overview of the demographics, these are individuals who've been unsheltered homeless, oftentimes periods of 2 to 3 years, or exhibiting symptoms related to co-occurring mental health illness and substance use disorder, and oftentimes have been intersecting with emergency systems, substance use treatment systems, incarceration systems, and have not found the stability to address the underlying causes of their addiction and homelessness. This program is 100% voluntary, and all residents have engaged and wanted to seek housing support and treatment options to engage in this program. At this point in time with the program, we've served over 66 individuals and have placed a total of 44 individuals into long-term housing placements across the Commonwealth, which is a huge success. 100% of all individuals that have participated in the program have engaged in housing search support, and over 70% of residents have engaged in on-site medical treatment, SUD treatment support. The trend we've really been seeing is that we're engaging individuals at a point of crisis in their addiction and homelessness, and that the safe, stable setting of the cottages in connection to on-site primary care, recovery coaching, mental health care, and added security provides a level of stability as they link to medication-assisted treatment. And what we're noticing is a significant decrease in individuals returning to the area of Mass and Cass, and a significant decrease in their active use and stabilization as we connect them to long-term housing supports and permanent supportive housing that's coupled with tenancy support services to ensure they're maintaining those placements. Our focus has always been to ensure the well-being of these residents than the larger park community. And I was very grateful when Christine earlier this month, September, flagged that there had been a notable increase in needle usage in the area in September. To note, though, this program has been operational since December, and we have engaged the program operators, Commonwealth Care Alliance and Elliott Human Services. We've ensured that there are sharp disposal units within the sites, including Pine Street, and have ensured that even in the Pine Street program, there's 24/7 security coverage and those needle supports as well. We would very much welcome the opportunity to, beyond sort of the ongoing communication with Franklin Park, to have quarterly meetings with leadership to ensure that we're monitoring the situation, ensuring that we're being the best of neighbors to the park and continue this great relationship. I'm going to kick it over now to my colleagues, Rita Chapladine. I actually don't know how to pronounce your last name, and Ray Murray, to speak to the program outcomes for the Shattuck shelter, and then kick it over to Justin Douglas as mentioned. But more importantly, we want to listen to comments and field questions from the larger community.
Hi, everyone. My name is Rita Chapdelaine, and I'm the Senior Director of Behavioral Health at Pine Street Inn. I'm here with my colleague, Ray Murray, to talk to you a little bit about the Pine Street program. But at first, I want to say thank you to all of you for tuning in, and to Christine and Ricky for facilitating this conversation. We really appreciate it. So Josh described in a very detailed way the services that we're providing on the campus. And I just want to reiterate, we're working with a group of 30 individuals who we pulled right from the Mass Cass area, people who've been living outside for a really long time. And we've had some really great success in things that we've been doing with this population that we're really proud of. We've housed so far 8 people from the Shattuck program, and all of our people in the program are working on housing. 90% of them have a housing plan. And we have a shelter staff, and we also have a behavioral health team in there, along with 24/7 security and nursing staff. And, you know, it's a really great program. It's completely voluntary. So everyone who's in the program has made the decision to come inside. And we really believe that we're keeping them safe in our program, and we're providing them with services when they're ready for them. And people seem to be doing really well. We've built relationships with the people who are staying with us. We have had a couple of people who have been outside for so long that, you know, we find that sometimes they return to the street for a few days or a week. But we have such a strong support system within the city that we're able to engage with people and get them back. Our outreach team is always out looking for people who have disappeared from our program. But we're usually able to get people back and re-engaged with our staff. Ray, I don't know if you have anything to add that I might have missed here.
Rita, thank you, and Josh, for you guys pretty much covered everything that I was had in mind, but I think it'd probably just kind of wait for the Q&A and maybe some questions, but I definitely concur with both of you. The services that we provide have been, I would say, very helpful to the population that we've been working with, and we've seen a lot of great improvement in the program structure and how things have gotten to this point. So I do like to just take the moment to say that and wait for the Q&A part.
Thanks, Ray.
Thank you.
Another thing that I forgot to say, and sorry, Christine, I just sort of want to emphasize this point. When we first opened the program in early January, we were finding that a lot of people were every morning sort of edging to, you know, trying to go back towards MassCAS, and we sort of had a conversation with all of the guests in the program to say, you know, you're with us now, so why are you going back to MassCAS every day? We were finding that people had a lot of providers in that area. So the Shattuck Hospital actually provided some connection for us to provide medication assisted treatment for people right on campus. So we're really just trying to remove the connection with MassCAS by keeping them on our campus and keeping them safe. And we're finding that more and more people are returning to the program every single night. They're engaged here. They have everything that they need here. So we're really keeping them inside, which I think, you know, increases public safety in general, but also keeps them safe, which is our, you know, one of our priorities here.
Ricky, do you want to?
Okay, I think at this point with the community comment.
Well, no, we have Justin from who's the CEO of the Shattuck Hospital first.
Oh, okay, I thought he was part of the other group. All right, go ahead. Justin, are you there?
Good morning. Can you hear me?
Yeah.
All right, good evening. Thank you. I'm Justin Douglas. I'm the CEO of the hospital. So I'd first like to thank the Franklin Park Coalition and Christine and Ricky for inviting me to this meeting tonight to give information about the hospital. So I'll try to keep it quick, but so just to explain a little bit about the hospital, we're a 248-bed public health hospital. We serve vulnerable and underserved populations within the Commonwealth of Massachusetts, excuse me. We have, within our hospital, we have 5 locked psychiatric units that accounts for 95 of our beds. We collaborate with Department of Mental Health with those folks. We have 153 medical beds. Of those, we have a 29-bed locked correctional unit, a 6-bed intermediate care unit for folks who might need a higher level of care, chronic vent unit. So a lot of our folks, some folks will come in and they need vent support. And the remainder of our units are general medical floors, some surgical. A lot of the folks that are admitted are similar to the folks that are served in the cottages and the Pine Street Inn that might come in for long courses of IV antibiotics for heart and bone infections, usually as a end result of substance use. We have some folks who may be uninsured. And so we really serve a very special population. Between folks with mental health issues, substance use issues, and legal issues. Also within our hospital, we do have an outpatient clinic. We have radiology lab services for inpatients, an inpatient pharmacy, and inpatient dialysis for folks that are having issues with their kidneys. And we are one of the only public health hospitals in Massachusetts of the 4 of them that has a working operating room. So there we serve folks that needs general surgery, ECT, joint replacements, minor vascular procedures, dental procedures, more with our DDS population, and colonoscopies and endoscopies. And also within the hospital, we have the Pine Street Inn, Shattuck Cottages, which we're all aware of, the Marisol Center for Healing, Women's Hope, Andrew House, Victory Program, LARC, and HRC, or Healthcare Resource Centers, which is a methadone program. And these are all vendors. So they are essentially, they're not part of our census, but they're part of the hospital community, but they have their own oversight. And we do, in addition to the safety and security plans that are in place with the cottages and other areas and our relationships with the state police, excuse me. My apologies. Excuse me, hold on.
We can hear you now.
My Alexa is turning on, so my apologies. Hold on one moment. So. Okay, my apologies, that was very rude. So on top of that, we do have campus police, Shattuck Security on site as well, that collaborates with our partners at the cottages as well, and as you know, frequent communication with our Mass State Police because we are state property. If they, you know, so if they do rounding and they happen to see something off property within Franklin Park, they will notify 911, and then with the jurisdiction of Boston Police, they would respond. So I hope that's enough information for the Shattuck. And again, I thank you for having me on this call. So
I think if I can jump in with a key question that is in the chat, if any of the 3 of you can explain, does the low threshold housing mean that there are active users, and where and how people are using drugs, in whether they're hospital patients, shelter residents at Pine Street Inn, or in the cottages? Can any of you, the 3 of you, jump in for that?
They may need to unmute them again in order to, sorry.
I could speak for the hospital that we do not you know, tolerate use in the, you know, and the teams will address it if somebody is suspected of using, but I cannot account for the operations of the cottages or Pine Street.
And so does that mean that patients who are active users are not allowed to leave the hospital and use? Justin? Oh. You're on mute again.
There we go. So no, ideally we do not want them to leave the hospital. What you run into is like any one of us, that if we were hospitalized, if we have if we're competent and our own person, we can't physically hold somebody in the hospital. So our teams work diligently with our patients who may be struggling to keep them clean and to not use. So we don't allow usage in the hospital. And if somebody was suspected of using, the teams would intervene and come up with a plan to help mitigate that.
Great. Thanks.
Mm-hmm.
Josh or Ray?
I'm happy to go first. The program, it's a harm reduction program. I'm not going to say that folks are not using. As I mentioned before, we're actively meeting individuals that they're probably at the peak of need. And that, to note though, with active use, it's ensuring that it's monitored and maintained. We're not allowing folks to use to the point of self-harm. We have an obligation as service providers to ensure that folks are safe. They're not actively using at the park or at risk of overdose or withdrawal or other sort of negative outcomes from the disease of addiction. On multiple occasions when we've seen people use, we've had to directly engage. That's why we have 24/7 nursing, 16 hours of recovery coaching on site, as well as mental health and other support access. And we've oftentimes have had to section people and provide people a higher level of care. The goal of this program is to ensure folks are connected to treatment supports, are engaging in what we've seen as evidence-based practices and medication-assisted treatment, are ultimately on a path towards long-term stability.
More than half of our residents at the Pine Street Inn are engaged with medication-assisted treatment and following through on those protocols on a regular basis.
We're at approximately 70%. I think maybe a little bit higher. I can check the most recent data.
And for those of you who might not know, medicated assisted treatment is methadone or alternatives to illegal drug use. Yeah.
So Christine, we have a lot of hands up now.
Right.
Okay, so
I want to address just two things, if I can, that were so that everyone knows. There was a question about whether state police were engaged, and we did reach out to them several times, but have not gotten a response. And the state police are really only responsible for the zoo and the areas right around the zoo on adjacent to Blue Hill Avenue. They're not responsible for the rest of the park. The rest of the park is what Sergeant Sullivan, was responding to, which is all Area B2.
Christine, what about the bear cages though?
Well, that's a complicated issue because it is state property apparently right now, but the city is trying to, with our support, is trying to take over that property so that there can be renovation and work there and patrolling and police. But
Christine,
think
I just wanted to, on behalf of the mayor's office, give a quick comment on the low threshold sites, if I may.
Great. I
did want to say that one of the biggest barriers that we face citywide when we are offering people services to go into shelter and to spend their nights inside is those sobriety requirements for traditional shelter in most programs. And so the fact that we have this new model with the low threshold sites is really helpful because people are much more likely to take us up on that offer of services if it's under this model. And then the stats that were shared around how many people or the percentages of people that are starting to engage in housing navigation I'm sorry, and in treatment, whether medication assisted or not, are really high. And so I just wanted to speak to the virtues of this new model that have made us really just kind of remove that barrier and see people more likely to go inside, which is ultimately what we all want.
Great. So I just learned that Lieutenant Gregory Keene is on. Lieutenant, if you can unmute yourself. If you'd like to address, the state's police responsibility for Franklin Park.
Sorry, who is it? I'm not seeing him in the list.
Lieutenant Gregory Keene. I'm reading Barbara Quicklo's message. And then Ricky, go ahead, we can move us to.
Christine, if we're not able to, I can speak. We've maintained ongoing communication with Mass State Police and have a direct line to the Milton Barracks and previously the commanding lieutenant, Lieutenant Bazinati, and the current lieutenant, who I'm blanking on the name. The Shattuck Hospital is overseen in responsibility jurisdiction for Mass State Police, and we do post for a police detail for backup coverage.
Great. And then there's one other question in the chat that might be helpful. That's from Brendan. Is it possible to have places where people can actively use drugs on the Shattuck campus so that it doesn't have to drift out into the park?
I can take that first. We've anticipated the program design for the cottages harm reduction. The reasoning that we have internal security presence, that we anticipate there's a high likelihood folks that are still in the beginning stages of their tenancy at the cottages may be actively using within the cottages. We've had, I believe, under 10 overdose reversals, and oftentimes have reported to emergency medical services and ED and transition to more intensive substance use treatment services for that individual to help them on their journey to recovery.
Great. Is that possible at the other, like at the hospital or other Pine Street Inn, any other locations?
We assume that there are people who may or may not be using. It wouldn't be grounds for them being dismissed from the program. So, I think in other shelter settings, it could be a situation where someone is caught using near the program, and that's the end of the conversation, where we prefer that it's the beginning of the conversation. So, if somebody were found to be using, we would engage them in a judgment-free conversation to get them to stay in our shelter. Instead of dismissing them from the program and having them return back to the MassCas area or to the park or, wherever they might end up. So we're really trying to engage people in a judgment-free situation and keep them with us instead of sending them back out.
Okay.
Okay, we
I guess, well, we had the community comment. Questions
Just
yet?
one more. We did find out that Gregory Keene is on under.
Oh, he is,
So I just offered to unmute him, and then we can go to community questions.
Hello, can you hear me?
We
Yeah.
can.
Hello, I'm Lieutenant Gregory Keene. I've been at the Milton Barracks for approximately 3 months. Honored to be on this chat tonight with all of you. I tend to be a little bit more quiet and listen because there's so much experience and knowledge from all of you. Working with our partners at the Shattuck Hospital, the Shattuck Inn, and the cottages. I do want the community to know that our troopers do respond to calls for service at the Shattuck. We do typically assist with clients, but we are one of the last resorts to go there for any type of addiction or mental health needs. So having said that, our troopers respond there regularly just to patrol. Proactive patrol is one of the best things we can provide in that area. Yes, the majority of the locations are on Boston PD regarding this this chat tonight, Franklin Park, but we do respond there. I've actually personally gone there. Some of my other partners in community groups know that I do go out in the field and walk around. I go to the campus, I walk the campus, I take in certain elements, and I also tend to be proactive in stopping motor vehicles that may be suspicious in the areas around the park. My troopers do the same thing. What I do find beneficial right now is hearing some of the partners from all over the city talk about what they are doing to help this situation. So having said that, I would like to step away again and continue to listen. If anyone has any questions, I am reading the chat group. So again, thank you for your time.
Thank you. Brandy, are you on?
At this point, yeah, I think Brandy would read the instructions for the public comment or the community comments. Brandy, are you there?
Yes, I'm here. Good evening, everyone. The community comments and questions. Again, we'll repeat the instructions.
Brandy, introduce yourself first.
Okay. My name is Brandy Crutherd. I'm a resident of Boston. I work at Madison Park Technical Vocational High School, and I'm also known as Body by Brandy and promoting fitness in the community for over 25 years. I joined the coalition because I like the park and like to keep it safe, and moreover, I'd like young people to be able to enjoy it just as much as I do one day. With that being said, tonight we're going to talk about the community comments, and if we have any questions, each of us, there'll be a time limit. The time limit will be 1 minute for you to ask a question, and we'll direct it to the relevant public official. Please share how you feel. Please share whether you feel if the park is safe, what would make you feel safe, and what are your suggestions and ideas?
Brandy, I don't know if you can see the hands that are up, but I know Louis Elisa.
Do you want me to start going through the raised hands? I can do that.
Yes.
Okay, I'll start with Louis.
And I've got it too, Mike. Louis, you want to ask a question? Unmute yourself.
Good evening. I wanted to ask a number of questions, but given that you've relegated us to 1 minute, it's not going to be possible. You gave us an hour of stories and things that are not necessarily consistent with the facts, starting with the safety of the park, the number of police park rangers come through and how often, response to the park, the issues that go on. And I think that at some point there needs to be a more honest and direct conversation about what's going on in Franklin Park. It's a park, 480 acres. It's not supposed to be safe after a certain time because it's a park. And so it's very dangerous to be any place where there's not enough lighting and there's not enough support after a certain time of day. You wouldn't walk in the Commons, which has a lot more crime than Franklin Park and sees like 10 times more police and park ranger support. But the issues here in Franklin Park is the fact that it's not being maintained properly. The residents and the people who use the park can't see tents or anything else if the maintenance of the park isn't done. Leo and some of the others from the Parks Department have walked through. We pointed out the problems and where safety issues would occur. And so frankly, for the areas that we pointed out, when Miss Jean was attacked, they came from an area where the area was overgrown and where the person could not have a line of sight. So those issues have to be addressed. But I think we have to have a program where we have a real discussion. The discussion on Shattuck wasn't real and wasn't fair because the users, people are allowed to use as they use that site. Some of their people do come into the park. Some of their friends come to visit. They drive in and off the site. And all those issues are issues of concern for public safety. So I'm just hopeful that there's a time that we can have a real and honest discussion about how we can keep Franklin Park safe and utilize the resources. Finally, and I know this past my minute, the areas of the park we closed down so that the so-called low riders could not perform. In the last 3 months, there's been no problem. But in the bear dens across the street from my house on Seaver Street, students from the colleges came and had a beer party in the middle of the night on Saturday 2 weeks ago, and nobody came until I called the police 3 or 4 times. I'm going to say there should be fairness on how we treat all the users of the park.
And next I have Stephanie Jackson-Wilson.
Thank you, Franklin Park, for hosting this meeting. I would also like to thank everyone who showed up. I visit the park almost every day, especially during the summer. And Brandy, I see you all the time. What I don't see are police or rangers. Drugs have always been an issue in the neighborhood, but never have encampments been an issue. So you have this protocol that you say you have. The Shattuck has services, they have shelters, they have countless services. So I don't see why it should be an issue of whether a person can stay in the area or not. The other issue is I'm in the park every day. Only time I see police and only time I see rangers is when we do have events. When the children have the lights in the park, I see the police. And when we have jazz on Tuesday, I see a lot of rangers. Other than that, I don't see anyone. I don't see anyone patrolling anywhere. So we really need to get honest, like the gentleman said, about the safety of the park and who's doing what. We also, the friends, me and my friends who hang out in the park, we bring our lawnmowers and we bring bags and we pick up trash all the time. So it's like, we don't even see the maintenance in certain areas where certain people hang out. So I think it's very important that we do away with the encampments. You talk about offering people services. The services are right there. So if they're not engaged in services, then they shouldn't be allowed to be in the park. They should be asked to leave immediately. Thank you.
Thank you.
Let's get Julia Mejia, Councilor Mejia.
Well, I think we should go to Barbara Cricklow.
Okay. No, because I had to press a button to get unmuted, and I don't know if you can see me. How do I control the video here?
We
Is
can
there
hear
an
you.
option?
We can hear you.
That's fine. As long as I'm heard, that's all that really
We
matters.
can hear you.
So thank you for hosting, and I'm so encouraged to see the amount of folks who showed up, which really goes to show that this is definitely something that community is deeply impacted by and listening to. And I'm just curious, my question is, I'm wondering whether or not you all are able to share any data or information that you've learned from some of the previous efforts that we've made across the city? And what lessons have you learned, and what are you thinking about doing differently this time around at the Shattuck? What lessons are you looking to apply? What have you learned, and how is that informing your thinking? And that is for, I'm going to assume, whoever is willing to answer the question, maybe the administration, since you guys have been there and done that, but just curious about lessons learned, and how are you adjusting your plan
So,
accordingly?
oh, here we go. Go ahead, Danya.
Yeah, just can you clarify, Counselor, is this just about the Franklin Park or about the broader like intersection of mental health, homelessness, and substance use?
Yeah,
What are you hoping
so
that?
we all have seen what is happening at Mass and Cass, right? And we have seen the efforts that have been put forth. And I'm just curious, as you all continue to go, down this lane in regards to the Shattuck, I'm just curious about what lessons have you learned and what you plan to do differently.
Sure thing. I just want to first make the point that I don't think anyone here has the full facts about whether the encampments we're seeing in and around the park are related to the low threshold sites. A couple of the people that we have doing rounds in the park tell us that that's not the case. Again, we need to identify the individuals, but we don't have a conclusion yet as to whether those two populations are related. But as I said earlier, the low threshold sites, I think, are an innovative, really helpful model that has seen good outcomes for people. Like just today, I learned of a resident that's been stably housed after staying out on the street, almost passing away for months, and now someone that's stably housed and moving on. We are all also very concerned with the broader safety, biohazard, improperly discarded items like needles, or other paraphernalia that are found not only in this park or in other parks around the city, but citywide. I mean, this is to different intensities a citywide issue. So what I have shared is the encampment protocol that we do apply and are not at this point planning to modify unless I receive great feedback from this group and others about points that we might need to modify around how to respond to an encampment. The response is still going to be outreach with, I think I see mentions of social workers, that's what we're providing. And we are resolving those encampments that way. We do wish that we had more housing available, more low threshold units, and more permanent supportive housing available for people. And we today and moving forward with this and the next administration at the state level are in conversations about what kind of funding and what kind of convening power they can support us with so that we can have these resources available in other cities and towns, which we think would be crucial for us to kind of help support people that are from Boston or coming from other communities to receive those resources here. And then lastly, I'll just say the public safety piece, that is part of the approach. There are individuals that sometimes may be involved with what happened with Miss Jean. Those, again, I don't want us to all conflate those issues. Those are separate issues, and they're not always related. And I think sometimes our minds go there, but it's not. We have to be fact-based in those discussions. And about your question about what we are planning to change, we're changing every day. We are kind of adjusting our approach every day as far as Franklin Park specific. I'm here just like you and just like everybody else representing their different agencies, listening to community needs. I will say that we appreciated the letter that Franklin Park Coalition sent to us, asking for really specific interventions, increasing lighting at the Ellicott Arch, beautifying and increasing activities in the area, police call boxes and police patrol cars. So we've responded and are working through those items so that we can address them in a really concrete and specific way. So that's kind of what our approach has been so far.
Thank you. Next question.
Hi, my name is Barbara Critchlow, and I have a problem with the whole issue of that project being in Franklin Park. I noticed that because I live in this community, I've seen some of these folks that are supposed to be in the encampment that should not even be in our park, but I see them out on the streets. We have a charter school that is in less than walking distance, the Brook Charter School. That's a danger when I see those kids out there trying to get on the bus and then there's strangers walking around. I also have a problem with the fact that when I drive down the street, I see some of the patients out on Morton Street and they're in some sort of danger because they've already shot up and they're out of control. Franklin Park was a place where families could go. Children could run around, have a good time. That's what it was. It's not that now. We can't trust the fact that if you see a child running through the grass or in the field or whatever, they're not going to get stuck with a needle. When you start finding needles, then you already have a problem and it needs to be addressed. That needs to go. I don't, obviously you must understand that I don't want the Shattuck in the area anymore. I want the Emerald Necklace to be complete. And that's what I have to say about that.
Thank you, Barbara.
Thank you. Next question or response?
I'm unmuted, so I don't know if you guys can see me.
We can.
Oh, great. Good evening, everyone. Nice to be here with you, see so much familiar faces. Thank you, Christine, Mike, and of course, Mr. Thompson, everyone here, Brandy. I also see you in the park. I can appreciate the meeting and the effort to convening community. However, this community process, or what's supposed to be a listening session or a community process, it does feel a bit policed and controlled. It doesn't feel patient or graceful. We cannot continue to coordinate meetings like this in the community and say, we want to hear from you, the community that live here, that pay your taxes, that nurture this community, that uses this park. We want to hear from you because you're important, because we care. And so your voice is important. And then we come to the meeting and then the community is not heard. So the 1 minute, and I understand time constraints, but then you should redo it, or you should do a longer meeting. You should allow people to actually express themselves, and you should be more patient with this process. It does feel sort of staged, where everything is sort of saying it's not, it's safe, it's safe, it's safe. And what's the issue here is that it's safe for whom? And then when you say things are unrelated, for example, needles are being picked up, we shouldn't conflate issues, or when you spew narratives like that, then I have to ask you to give me your sources, to give me your proof, to give me your evidence as to what you're speaking about. And I'm speaking with you, Tanya, my dear, take this with all respect. You know, I do appreciate and respect your work, but I think that when you come into Roxbury and we're talking about, and I know Franklin Park, arguably Dorchester, Mattapan, historically Roxbury, so all of Roxbury feels we belong to Franklin Park. Now with gentrification and all of these changes, you have very different type of community members that are coming together and convening and now advocating for a thing. But you have to put things in historical context and really try to think about those who have suffered this area from the hands of the violence, and all of that took place in this area. And now that we look at opioid as something to be treated with as a mental health crisis or as a sickness, we deal with it differently, but we also prioritize people differently. So when you say it's not safe, me as a Black woman, am I safe to walk down in Franklin Park by myself? Me as a Muslim, Black, short woman, am I safe to walk in Franklin Park by myself in the middle of the night? Obviously, we have to look at the data and see who is getting hurt and who's not getting hurt. You can't possibly tell me that it's not because this is new. This level of crime that's coming in is not the things that we do, that we are used to in Roxbury and Dorchester as a Black community. So I would say that, and I would say, can we please try to, yes, yeah, and I lived here all my life, Brandon. And so can we please try to redo this meeting? Can we do this in a better way? Can we actually start with community first? Can we prioritize community? And I come from, by the way, my background is mental health and substance use. I've worked with this population. I work for Department of Mental Health as well. And I see, shout out to Miss Leah Randolph here, who I work for at some point. And so I understand this in depth, so it's not like I'm being insensitive, but we have to continue, we have to stop concentrating poverty in Roxbury and keep and using excuses to just put all of the resources in the treatment and anything recidivism, anything halfway house. I live around 7 halfway homes on Humboldt Ave. So we have to actually be very honest about what's going on here. And if you're going to listen to community, let's do this process over and let's really allow community to voice their position. Let's not police the community and let's be a little bit more gentle with how we address each other.
First, I want to say we appreciate all the comments that you made. And I also want to say this is the first time that we've gotten together to really create this kind of platform. And you've seen automatically, we started off by being sensitive, by exceeding the time so people could hear that their voices will be heard, and we will do this again. So this is the first start of change, and change is small, and it's gonna get bigger and bigger as we can continue to work together. I'm gonna continue tonight. I want everybody to know your voices are being heard. I am community. Franklin Park Coalition is community, and I believe Parks and Recreation and every counselor on here or city official is community as well. So please be patient, but let's listen to each other and let's continue to work the process. I'm gonna go next to Reverend Culpepper.
Thank you, Brandy, for acknowledging everyone on the call. I appreciate the call. I think it's timely. Especially since the issue with Jean McGuire. But this is what I'm wondering. We've got 2 city councilors on the call. We've got State Rep China Tyler on the call. And I'm wondering why we just don't get with the Boston Police and the state police and the those ranchers or what are they called? The 3rd unit of police that are responding to calls, and why we just don't get with the city councilors and the Boston Police and the state police and have a schedule of police patrolling the park. I don't think this is complicated. I think we got to keep it simple. I think we've got Boston Police, state police, and the Rangers can get together. We've got 2 city councilors on here and a state rep. If the city councils need to call a hearing, they can call a hearing to get the state police and the Boston Police and the Rangers before them. But I don't know why we just don't get someone to sit with them and say to Commissioner Cox, we need a schedule of when of the police being in the park, work it out with the state police and the Rangers. It's not complicated. And we got to keep this stuff simple. I live right across from Franklin Park. I see the camels every morning. This house has been here. My family has been in this house since the 40s. We've seen all kinds of changes in the park, but we also saw for many years those officers, the Rangers on the horseback riding all day through the park. And so I don't see why we can't keep it simple. Just have someone, the city council there on it, set up a schedule, get the police to the park and get some schedules so there can be more safety than there is now. It's not complicated. We need to just keep it simple. Thank you.
Thank you. Does anyone have any response to that? Or I'll go to the next question. Excellent. Can Mr. Clifton Brothwick, you're next.
Hello, everybody. Thank you. My name is Clifton Braithwaite. I'm a longtime resident of Boston, and I made way from Newton to Boston. I've been here 47 years. And I'm hearing a lot of everybody speaking, but we're not getting to the meat and potatoes of what's going on. I'm a 60 baby. Everybody likes to say 80s. I'm a 60 baby. Even in the epidemic of what was going on around Roxbury and Dorchester, the park wasn't even that dangerous. We knew our counterparts, the people, white people, could come in the park and be safe. We knew as families that was a safe haven. Everybody knew back then Franklin Park was the safe haven. So what I like to say is stop the garbage. We need to put one unit together of all the different officers to have one unit that patrols. You're worrying about the daytime, it's about the evening activity after nighttime. One, we need better lighting. Lighting might be a problem, so we go with solar and we put it up through the park. It's done in other parks and other communities. We need security phones throughout the park. We don't have that. Everything y'all are talking about to me is a bunch of talk. I actually walk through that park all the time. I stop a lot of activity that happens that doesn't hit y'all radar. You're not talking to the community. You're not talking to the residents that have lived here for years. There's too many newbies, and we don't have time for a training ground. You really, right now, there's enough people on this phone call that are from the community that I know me, that we know each other. We're tired of what's going on. You need to have patrolling later. And if you want to get further into this and get into the meat and potatoes so someone else can speak, I agree and concur with everybody. But your newbies, we don't have time, your testing ground. You need to really get together, mobilize a group like the military would do. They'll put everybody together and the president will have one staff that works in the park. That's what you need to do by circling the wagon so we can have true reports on what's going on. Once again, my name is Clifton Braithwaite. God bless the Commonwealth of Massachusetts and the Boston residents that make things happen. Now make it happen and call us. Thank you.
Thank you. Up next, we have Domingos DeRosa.
Domingos, you're muted. You have to unmute yourself.
Hello, am I unmuted now?
Yes.
It keeps telling me the host keeps muting me. Hi, everybody. Glad to see a lot of good faces. Excited to speak. We created a group called the South End Roxbury Community Partnership because of the issues we faced as a city down in the lower Roxbury, South End area of the city, South Bay, Dorchester portion of the city. And we warned folks as a city what was going to happen when the city started to fan out services from Mass and Cass. Those tiny homes were a discussion over 2 years ago. And now they actually are placed at Shattuck. And they're looking to add to the area. And the biggest issue that I see is a lack of interest from certain entities, not only in the city level, but state level. This problem is only going to grow. It is not going anywhere. They are shoving this down our throats, if we like it or not. We are speaking to deaf individuals who have their own agenda, who are going to push this as far as they can. And they're going to continue to add services because of decentralization of Mass and Cass. This is not the first incident that has happened within Franklin Park. This is probably one of 1,000 in the last 3 years that's happened there. The bus stop on Blue Hill and Columbia Road is no longer a bus stop. It's fenced. That seems to be the solution. We have gates put at the entrance of Franklin Park that's supposed to be closed at a certain time of the day, and they're not. That would help some of the issues, but then at the same time, it takes away of the access of cutting through Franklin Park for folks who live in Hyde Park like myself. So what I want to suggest to this group is to join us when we meet. I believe we have one coming up. It's the Mass and Cast 2.0 meeting that's held once or twice a month, and we talk about all the issues we see on Mass and Cast that's going to be a part of this conversation because it's moving. This is live and it's moving. And until we come together as a city and address this, it's not my neighborhood versus yours. It's not, one issue versus the other. It's a citywide problem. And folks have neglected for so long that we are now faced with this troubling situation in Forest Hills, on Morton Street, Mattapan Square, Ashmont, Pierce Square. So, when I drive by and the kids are seeing folks injecting themselves in all parts of the city, I said this to the city a few times and the governor. And again, I'm gonna keep advocating for a change because, I had a child get pricked with a needle less than a month ago. And, he's on his last leg of a cocktail to make sure that, he doesn't shorten his lifespan, right? And the sad thing about it is our state and federal representation are never at this conversation. They're never at the table with us. We have to make sure that they get involved so they can make sure that they press the governor, soon to be whoever we elect, and at our federal level, because these folks are not responding to emails. They're not responding to phone calls. We've been getting crickets. And when I say we, the South End Roxbury Community Partnership, we are a very diverse group. We have lobbied the State House. We have lobbied City Hall. We have lobbied in so many different ways to gain the attention on this city issue. It's a humanity crisis. But at the end of this, our communities are dying. We've already dealt with the crack epidemic that half our communities are in prison. The other half is still trying to get off the drug, and it's not being treated the same. 69% of the overdoses in Massachusetts are Black and brown men and women. That's a little over 1,300 deaths a year that affect you and I. And that's not being put out there so people can better understand why it's important for us to have equitable services and treatment. And that's not happening for the people that look like you and me. So, when we see these tiny houses come up by the Shattuck, and then we have the increase of violence, let's think about the $5 million in overtime that we're spending on the police department that's doing little to nothing because they can't enforce the rules and regulations and the laws that are on the books because the higher ups are telling them not to. So I'm gonna yield my time. I appreciate you guys coming to the table tonight. And I continue to stress the importance of us adding voices to this conversation that are not professionals. I'm tired of the professionals telling us that they know exactly what we need, and we don't need them to keep shoving more crap down our throats so they can come back and give us more numbers that do not make sense. 5 million needles
Domingos
collected in 1 year? You tell me how that makes sense.
Excuse me, Domingos, I don't want to interrupt you. Before you go, could you come back on? I want you to give everybody where you said that you have the meetings. That was really important. That was something that people said in the chat. So could you tell us how we can join the meetings on Mass Ave and Molina Cast if there's one coming up? Thank you.
I'm gonna put the information in the link in the chat so folks can join, because this has been I'm sorry guys, my passion looks like rage, but it's not rage, it's passion. I'm tired of showing up to meetings where it's a one-sided conversation. It's being dictated by one community versus the whole city. People are controlling the narrative So we get saturated. Again, the language in the laws, right, says most impacted communities. So of course, our community, who are the ones most impacted, wind up with the sober houses, wind up with the dispensaries. There's 2 safe injection sites on the books who are supposed to come to Boston. And that's going to be put in our community because the conversations are being in silos, and they're keeping people like myself, Jahida Lopes, and others who are fighting for a space at the table because they don't want us to spread the truth of what's really going on in Mass and Cass. There's more overdoses of you and I in the state of Massachusetts than homicides, but they put all their attention towards the homicides, which one life too many, we losing. We're at 34 murders a year, and we're already at 1,000+ for overdoses. So the numbers for me, this has more precedence than a lot of the other issues that we're working on as a city. And if we're not willing to take, not ask, take what we're asking for, we're going to wind up in the same situations. We're losing sons, we're losing daughters, we're losing mothers, we're losing our elders because of the situations that we continue to allow others to dictate. These NIMBYs from Swamp Squad, like Miss Baker, that does not want to see needles in front of her house, but it's okay for you and I to pick up needles, give people Narcan because they're dying in front of us, which we should help our neighbors. But it's not fair to our community that we continue to be the ones to carry the burden. It's not fair. So I'll stop at that. I listen.
You know something? I want to say this because it's important. People live in the community are very passionate. So we don't want to marginalize your passion at first. I want to let you know, we appreciate it. And it's heartfelt. And it's things that we do need to talk about because we are a community of feelings and a community of healing. So I want to acknowledge that. Please put that information in the chat so we can all join and come better at exchanging stories and learn more. Thank you for putting that in there. And Brandon Halpin, you had a question. You came off it, your hand went down, but I'd like you to come back and answer, have your question heard or your comment.
I don't think I see him on, Brandy.
Okay. So there was another person that had a question.
We still have we have 5 hands raised that I see.
And then
I see it now.
have Elle Hardy, who wasn't able to raise her hand, but would love to say something.
So next week, let's go with Frederick Veterling. I'm working from 2 computers, y'all. So
Brandy, thank you for, I'm going to try to keep it short. I really appreciated Domingo's presentation. I think a lot of the meat of our problem is in what he was saying. And there's just so many people that need to speak up. So I'm going to try to keep it short. I'm really here to support my neighbors, the people that are neighbors to the park, Stephanie, Lewis, Barbara. I'm just listening to people now. In 2009 to 2011, the Stony Brook Neighborhood Association, which really encompasses Williams Gate, the Williams Gate entrance to the park, we had 32 neighborhood cleanups of that entrance, and we really did a tremendous job. And we even took down some of the chain link fence, and the park provided black chain link for us, vinyl covered, and that was the final thing. We put a wreath on it in December. And since then, we've kept an eye on it and tried to keep it neat. But we actually had a little problem this summer. Nothing was really cut until July, but we kept at the city, we kept at the officials, and finally it's all back. It's all been weed whacked again. It looks great. But in that process, I discovered my neighbor, Rory Cuffey, and he had been encountering needles. I mean, so many needles. He actually has a website where he posted, it's called Boston Heat Map. And in just the 1 month, I think it was posted in August, he found 250 needles in the Williamsgate area. And it's stuff that's happening right out in the open. He lives on Forest Hill Street right across. just the way a lot of these other people do, like Louise and Barbara. And I just think it's important that we're heard, you know, the people, their neighbors are heard. And so he went on the Boston site and found out that the needles really coincided with the arrival of the temporary housing. And I'm not trying to point the finger, because Pine Street should be lauded for the effort they're doing to try to get these people off the street. But at the same time, if we get to the point where we can't send our children, not my children, but your children, into the park because we're afraid of a needle laying in a ball field. I mean, there are already parks in the city where the sports teams don't go anymore because they can't be sure there won't be needles laying there, these small things laying in the grass. And so I want to get to the elephant here. Well, the gorilla here, this is like little Joe thing here, is that what about these 400 units of housing they're saying they're going to bring to the park of low threshold housing that the state, the Department of Health and Services is going to bring to the park? I mean, how can we even manage? We're even having a difficult time managing. And I know Pine Street Inn will do a good job if they keep working at it. It'll be better. But to take it from 30 people up to 400 is it's just beyond belief. I mean, it's taking the whole Long Island shelter and putting it in Franklin Park, but Long Island shelter, drug dealers couldn't go out there. They couldn't go across the bridge, whereas Franklin Park's open. And I just think that is the bear, that's the gorilla right now to me, is like, how are we going to manage this? And I want to address this as a question to whoever is in charge. And I don't know if there's anybody from the State Health and Human Services here, because I think they're in charge of the new program. What we've heard is 400 units coming, but who can answer? How are you going to manage when it's difficult? And Pine Street Inn, I mean, I've toured their facilities. They do great work, but how are you going to go from 30 units to 400? I want somebody from the state to answer that, because I know it's a state jurisdiction. I think there are a lot of other things I could say, but I want to leave time for other people as well. But can someone answer that? Thank you.
I thought I had someone here that chimed in to
Hey,
answer.
Grant, this is Josh Cuddy from UHHS. And thank you, Frederick. And I do want to really emphasize, I greatly appreciate the passionate dialogue related to this. And I'm always happy to keep the conversation open. And Domingo, I really appreciate your passion as well. And have met on multiple occasions with the South End Roxbury group. So in late August, we received one proposal for the RFP, which was from Boston Medical Center in collaboration with the community builders, JP Neighborhood Development Corporation, Pine Street Inn, Bay Cove, and other service providers. We can't share specifics about the proposal at this time, but we do want to provide some clarification on the process and emphasize that the proposal represents the beginning of a new stage of planning for redevelopment and not a finalized plan. The proposal has been in response to an RFP, which was informed by years of public engagement, including a thoughtful and inclusive vision plan and health needs assessment. And what has been proposed by BMC is not the state's proposal for the site, but rather a response to our shared visioning process and RFP. I also want to note, there's been clear evidence that the COVID-19 pandemic has had a profound impact on mental health. And this is seen in 2021, we saw an 8.8% increase in opioid-related deaths across the state. It's a crisis. And the programming at the cottages in Pine Street and Shattuck are just a small portion of the larger efforts that we've taken most recently. And thinking through the Bureau of Substance Abuse and Addiction Services, their low threshold housing initiative that recently launched in the past year, we're expected to scale it up to 300 low threshold housing units that are located across the Commonwealth, not Boston. 2 weeks ago, we released an RFR to provide $10 million funding for statewide low threshold transitional housing programs based off the success of the cottage and the Pine Street to focus on hitting those problems in the state and not focusing and centering services within Boston. Additionally, in the past year, we've seen the state individual shelter line item go from $55 million in FY21 to $110 million for FY23 to increase scale and scope to serve homeless individuals with co-occurring substance use and mental health disorders across the Commonwealth. Additionally, DHCD under this process is in the process of implementing guidelines to ensure shelters statewide are more accessible to these individuals. Additionally, in addition from DHC, we've also implemented new funding through the line item 0105 to add an additional 200 beds of low threshold and permanent supportive housing. I realized that was very quick, and I wanted to keep it quick because I more importantly want to leave room for community dialogue. So I appreciate it. But I thank you.
There's some questions that I'd at least like to ask you, two of them. One of the biggest ones was the community part of the vision? So if you could answer that several people asked that same question. So if
Yes,
you could.
I can pull up the list of we had a community advisory board and engaged members and had representatives from multiple of the neighborhood coalitions. Let me try to pull up the list and put it into the chat.
That would be great. And again, we're going to continue this dialogue. I'm going to go ahead, Josh. Thank you for responding. I'd like to we have like 4 more people that want to ask some questions. So I at least want to continue with on with the question. Samantha Montano.
Hi, thank you for the opportunity to speak on this. My name is Sam Montano. I am the Democratic State Rep-elect for the 15th Suffolk, which will no longer include Franklin Park, but I live on Ifley, directly abutting Franklin Park, and walk through there frequently. I ran on a platform of substance use and abuse and being able to address mental health supports that go with that, and as well as being able to provide resources across the state for a lot of the issues that are coming up. I had substance use and abuse in my family growing up, and I understand the impacts that it can have on you as you're navigating life, and then on the community as those folks navigate the community. I know this is also something that leaves Franklin Park and spills a little bit onto the Eggleston Main Street area on Washington. So this is not just focused in the park. This is something that's impacting our whole neighborhood. I know that also we are struggling with housing, and that a lot of folks are unable to have housing, unable to have access to jobs, unable to have the resources that they need. Something that I'm hoping to bring to the State House is long-term supportive care for folks who are moving through substance use and abuse issues. We can't just put people in 30-day programs and expect them to be better and put them back on the street without the support and resources that they need. So this is a long-term problem. I understand that it's something that my community has been struggling with for a long time. This is something that's impacted me. I know that my dad was able to get sober because he had the supportive systems that supported him longer than 30 days, longer than 90 days. Sometimes this takes a year. Sometimes this takes 2 years for your brain to reset. It's a really complicated cycle. And I understand that it's impacting our daily lives, but we also live in a city and we live in a community, and that means we need to make space for each other. And I think that how we should move forward, in addition to being able to have these spaces where we can air our frustrations, where we can air our grievances, where we can talk about the inequities of how the state has put certain resources some places and certain resources not in other places, is an opportunity to understand that this is a collective effort. And you know, as a state representative, this will be my first year, and I don't expect to be able to do a ton. You start at the bottom of the pool. I'm sure that lots of folks here can say that, you know, I'm not going to come in with a ton of power, but I would like to be able to continue to address this and to be able to work in coalition with all of you to make sure that we are getting the resources that are long-term and sustainable into this community so that we can move more folks out of substance abuse into long-term community members who feel supported, who feel like they can access the resource they need, and who feel like they can have access to housing, just like we're all looking to do and we're all looking to benefit from. So I just wanted to say that I look forward to being able to move forward in this work collectively. And I do understand that it is frustrating to be unable to feel like you can use spaces in public, like Franklin Park, which is a great space. And also to feel like we're being crowded in this city. And I hope that we can figure out the best way to move forward. But I just want to say thank you, and I am here to listen.
Thank you, and we appreciate that. Now we're going to move on. Yahara Lopez, we have still 4 more questions.
Hey, good evening, guys. Thank you for having me. I'm Jahida Lopez, one of the founding members of the Southland Roxbury Community Partnership, along with Domingos DeRosa, Marla Smith, you know, a shout out to a few of us. But what I do want to say is that I think the concerning part is that I think we all know that individuals need help, and they require more help than 30 days, just like the lady before me spoke. We know that more needs to be invested. The question is, why more in the Black and Brown community? So we have to take a look at the narrative that continues to be imposed on our Black and Brown community. Every social ill is dumped in Black and Brown communities. Everything that is narrative around gangsters, violence, all the resources, all that is centralized in Black and Brown communities, which means that we're not allowing our white counterparts to step up and want to help aid the situation in their backyard. I can say that when we started this group, we were called NIMBYs, including by some of the individuals that are labeled as experts in this space. They would sit in community forums calling community residents NIMBYs. Meanwhile, they get to go to a different community outside of Boston, and they don't have to worry about needles on their steps, feces on their steps. You know, for those that don't know me, when the creation of the Southern Roxbury Community Partnership started was because my mom was one of the individuals that has been robbed by needle point in the South End. I grew up in that South End. We've been on Northampton Street for over 30 years. And so we have seen the community go from zero to a whole different level of what's happening on Mass and Cass. And anybody who grew up in the South End knows that we've been aiding and helping to address that situation from way before Long Island even closed. And furthermore, if we get into the history of that location, the war on crack started in that same location on Mass and Cass. So what were we doing? We were aiding white rich people to come into black communities so that our Black men, our Black parents, our Black women are serving drugs to rich white people so they can go back to their backyard and go get high in rich, you know, big homes. Meanwhile, our family members are getting locked up for selling drugs that the police planted in our community, where they took over those amazing $1 million brownstones that we all see. They took those from our Black and brown community members. So this is not about, you know, we know that we need to do this and we need to do that. It's about facts and facts only. This community and this location has reached its breaking point. That's period. Whether an expert or whether a white person who's commenting through this chat saying we need more where? We need more white people to step up. We need white people to own this in their backyard. Because if we're aiding everything, why can't they help us? Why is your property taxes better than Boston's property taxes? Why are your educational systems better than Black and brown Boston educational system? Like, we need to spit facts and address what's happening here. Nobody wants this in their backyard. And white people constantly sit in these forums telling us about our plight, but none of them are fighting to have a safe consumption site in their backyard. Because they know if they stand up in their community in town council meetings, they're gonna get shut down. So we use Boston and the openness that Boston has, you know, the real estate galore that's opening to, you know, a lot of nonprofits with LLCs to continue to build, you know, shelters and more apartments and things like that to aid in our community, but no one is thinking about the impact. Where are the research that shows the impact of these things in our community? The Black and brown community is already dealing with tons of trauma. And we're gonna add more trauma. So we want kids to be productive in our communities, but they can't use their community parks. You know what I mean? So like, I just want things to make sense. And I echo Domingos because the passion is real. And my story has been very upfront. My brother was on Mass and Cass. My brother's doing 30 years in a 30-year bid in Florida. We tried private government assistance, you know, services. Unfortunately, it didn't end too well. The only reason why my brother's alive today is because he is in prison. And please don't misconstrue my words and say that I'm saying the prison works. That's not what I'm saying. I'm just saying that that's where his path landed him, regardless of what we did. The question becomes, why does everything have to be in Black and brown Boston? Why are more white-led experts navigating and telling us our Black and brown plight and what our pain and suffering looks like? That's where the frustration lies. And I hope that when we discuss decentralization, we're not meeting more Mattapan, more Dorchester, while every other community gets less. We're already dealing with too much. We need help, period. Thank you guys for your time.
Thank you.
Thank you. Thank you. We're going to continue on. Ms. Lopez, really, thank you. Ms. Freeman, try to make sure everybody time will probably spill over.
Brandy, there are people
mindful of
waiting.
time.
Brenda, there are people that have been waiting for a while. Gwen and,
We've,
I have to see everybody.
no, I think
I'm
we
going
have been
down the
going in
list
and
right
all
now.
raised hands.
oh, okay.
Okay, I'll try
Yeah,
to
I'm going
be,
down the list.
I'll try to be brief. I think
Say-
they are, the hands are in order. The neighbors who have spoken already have said better than I could, so I'm gonna try to touch on a few different topics. Starting with the heat map that Frederick referred to, the 311 calls, if you look at the numbers, those may not just be one needle. When I've walked through the parks, you might find a place where there's 20. You know, these are large numbers, and it is a change in the park. I want to say up front that, of course, Mass and Cass needs to be addressed. And kudos to Pine Street Inn and all who are dealing with it. But hopefully the solution isn't to just move it to any single other location. I'd like to see the state do an equity analysis and challenge you to find another neighborhood. I'll reference a map that I didn't create, but I trust it. A Stony Brook resident, if they build 400 units at the Shattuck Hospital site, that'll make over 800 units in recovery units in a very small geographic area. I challenge you to find another part of Boston, and that's not even counting the 7 safe houses that Councillor Anderson spoke about. It's like a really tight area. Pine Street Inn's already building their biggest facility on Washington Street. What is it, a quarter mile away? So it's a question, really an equity question. And I'm not making light that it's easy, as others have said. Nobody's exactly saying they want these things, but who doesn't know someone struggling with mental health or addiction? We have to all open our hearts, and not just the places that have already said yes, but maybe some new places. I want to thank if she's still on, Samantha, congratulations and welcome, and appreciate your sharing your personal history. That can't be easy, but I just hope we can prevail on the powers that be to make a collective effort. And for the state, sorry, Josh Cuddy, you seem like a nice guy, but to say that the proposal isn't the state's proposal, but rather the proponent's response to it, if it's out of line with the vision, it's just doesn't see, it seems like too easy to just say, oh, it isn't our proposal. So I'll leave it at that. Thank you for giving me time to speak.
Ms. Freeman, thank you for speaking as well. Next, we're going to move on to Senator Wilkerson.
Can you hear me?
We can hear you.
Good evening, everyone. So there's so much that's been said. I'm going to speak quickly because I know that this evening is full. I think Fred talked about the elephant in the room. I would describe it a little differently, Fred. I think the elephant in the room is that without any conversation, community process, discussion, Roxbury, Mattapan, and Dorchester have been chosen as the new site to make up for the space that was lost on Long Island Shelter. The fallout from this has been massive, and Domingo said it's just begun. It will, as the weather gets colder, it will get worse. It will only get worse. 400 units is absolutely nonsensical. The concentration in that space doesn't make any sense. And to say that this was the result of a community process is the same old, it's the same old trick. Here's what happens. We have a meeting. People get to speak. We'll speak tonight. They'll do what they want to do and says, we had a community process. That's not what this is. That's not what that was. You won't find any organization, a group on Roxbury, Dorchester, Seaver Street, Walnut Avenue side that says, I went to the meetings and I completely believe that the right thing to do is to put 400 units serving the population in Franklin Park. It makes no sense. So two things. One, fallout. And yes, it's never over until it's over. So I don't accept that this is fait accompli, but I do think that we have to think about what is going on right now. So there's been announcements that nearly every pharmacy within a 2-mile radius of our neighborhoods will be closing because they can no longer support the theft that is going on, because we've scattered people who are looking for drugs, who obviously are not working, can't pay for them, into the neighborhoods. And of course it has increased. South Bay is no exception. You can't get what you need. Basic toiletries and Target and South and Stop and Shop. The Walgreens in Nubian Square is closing. I saw a list today. Now says the Walgreens on Columbus Avenue, the Walgreens on Warren Street. Folks, think about this. If in fact we are not going to be able to get access to pharmacy and medicine because they have been kind of brought to their knees under the theft because of the population that, as Domingo said, we're scattering in the neighborhoods, right? That's what's happening. This is real. This is a bigger conversation than about Shattuck. And I think we got to get a handle on it. It's not at all a collective process. Opioid death has now become the leading cause of death for Black men in Massachusetts. I think it's increased 250% since 2019. This is not a joke. This is not a conversation that we're going to resolve tonight. This idea of further concentrating recovery in a park makes no sense. I have pictures. I'm one of those people who has pictures of the tents up in the very space that the city thought, or who the state thought, by blocking it off so the kids couldn't drive through, right? So they couldn't get in. What we created is a fortress for the people who have now set up tents there, and they living there up in the bushes. And so those things don't get thought out. They don't get planned out. We have neither a maintenance or a safety plan for our parks. Not Clifford Park, not Franklin Park, while we're watching the big announcement in the ballyhoo over the new plan for Boston Commons. And you can bet that when it happens, they're going to have it. And so you can't have this conversation without talking about racism, because that's what it is. That's what it is, folks. That's what it is. And I think internally as a community, we got to get some stuff together as well, because this is probably one of 15, 20 meetings that has occurred about crime and public safety just in the last 2 or 3 weeks. I said, elected officials, if you're going to lead this, right? So that we don't have to pick, we don't have to choose, and that we should have clergy, right? We got to have clergy there. We got to have the stakeholders there. But we need an all-around plan for our parks and our space, from Grove Hall, from Nubian Square, where you have our businesses that can't open in the morning because people are having their morning sex in the doorway, and the restaurant owners got to wait till they finish before she opens. It ain't pretty. Got to talk about it, but people are living outside. And when they live outside, they're going to piss outside. They're going to crap outside. And it may disgust us, but they're living outside. And so I'm all for, we got to talk about it. I don't think anybody who's spoken, this is not about addicts. Not all of us have a story. I've lost an oldest brother and an oldest sister to addiction. Both of them at one point lived at the Shattuck or got service at the Shattuck. Well, that's not what we're saying. We're saying this is different. This has changed, right? We have continually been dealing with, this decision to close block the traffic in the park on the weekend. But most people don't even know whose decision was that. What was that supposed to do? What we have done by blocking community out has created more of a fortress for the people who snuck in and now they're living there. This is not a good idea. We got to do everything we can to stop it. Having some coordinated meetings that get led by the elected officials, the clergy, the stakeholders seems to me the place to start. But we don't have a maintenance or a safety plan for this park, for Nubian Square, for Grove Hall. And so you'll see. So Pine Street will get $5 million from Mass and Cass, and the brothers from the nation who are trying to police Nubian Square get $30,000. You see what's happening, folks? This is crazy. People are making decisions and stopping to use that park. They're not walking their dogs, they're not walking their kids. We can't concede it. We can't. And so it's got to be more than tonight. It's got to be more than a meeting that the state calls. Brandy, you are doing an incredible job managing and making sure everybody is participating, but make no mistake, this isn't it, folks. You heard I understand you got to come on, you do the presentation about how the static and the 400 units, and this was a community process. No, it wasn't. It was a community opportunity to listen, and we were able to talk, but nobody said, I know, let's put 400 units there. It makes no sense. The first and only conversation we should be having should be about a safety and a maintenance plan for our parks, whether it's Grove Hall, Nubian, Clifford Park, and Franklin Park. It is not safe right now. And we have to stop before we allow any more activity to make it safe. So thank you for the opportunity. Yeah, no, this is crazy.
Senator Wilkinson, we thank you. One thing to give us a pathway to focus on two things. So you need to be acknowledged for that, especially your expertise and being in city government and having a real understanding of how it works, who's mostly affected. So on a personal level, I want to say thank you. We're going to continue the conversation. Louise, Elisa, it's your turn. You're up next. I don't know if you're there. I just see your hand. Louise?
Yes, I'm here. Has everyone spoken? Because I started off speaking.
I can let Gwendolyn speak first, and Mrs. Harden needs to speak next.
All right. Thank you, because I started off.
I appreciate that. Gwendolyn Brown, you're up next.
Yes, as I talked when we had the walk yesterday, can you hear me? Because I'm not sure.
Yeah.
Okay. Okay. The root of the problem, let's get to it. It's the Long Island shelter. Why are we not saying that enough? The Long Island shelter did its job. It worked. But now we have one city that has not been allowing Boston to rebuild that bridge because the people that own those properties, and I've heard a few of them that live there, don't want those buses going through their property to bring the people to the Long Island shelter. I worked in law enforcement for over 30 plus years. I brought people to the Long Island shelter. I've gone to the Long Island shelter. And I know it was effective. It wasn't perfect, but we didn't have Mass and Cass when we had the Long Island shelter. So why are we not talking about that still? That's the question.
Is there someone here, commissioner, city official, someone who can quickly respond to that?
Fine. Yes. So I did want to clarify that the city is definitely pursuing Long Island. It is on a long timeline because the buildings over there have been abandoned for several years. So the city is investing millions of dollars right now this year to make sure that rehabilitation project starts. And so the buildings become usable once again. As you know, and was mentioned, we are also in this protracted litigation with the city of Quincy that does not have an interest in allowing Boston to rebuild the bridge. So we are going through through that process. It involves a number of both state and federal permits. And yeah, we've been winning those cases, but have a few more to go. So we'll keep you updated on that. But definitely, although Long Island is not going to be a silver bullet that, you know, solves homelessness, substance use, and mental health challenges for every individual that comes through the city, it is definitely, as we see it, a big part, an important part of the way we need to address this issue.
Thank you for your response. We have a few more questions up. Ms. Hardin, if you're here, I know you couldn't put your question in the Zoom, but I was texted you'd like to ask a question. Ms. Hardy,
Marlene?
is she here, Christine?
Is that,
I don't know, maybe she's gone.
you say Hardy? There's
Yeah.
an L Hardy, there's an L Hardy in the,
Yep, that's her.
okay.
Thank you, Mike.
She's been asked to unmute.
Okay, great.
Hello.
Hello.
Can you hear me?
Yes.
Hi, can you hear me? Hi, this is Lolene Hardy. I live in the city of Boston. I walk the park probably 3 or 4 times a day. Now that I am retired, the same day G. McGuire was attacked, I was walking the park at noontime, came in around and went the other way. I've always felt safe in the park, even when, you know, on the news, someone was found dead. I walk the park by myself most of the time, but I've never seen police or any rangers on a horse until that day when I was walking. They were in a patrol car and that was it. But I am on the Franklin Park Coalition email list, and I've been to some of the community meetings, but I don't think, and I know for a fact that a lot of the communities surrounding Franklin Park don't know about these meetings. And even though I'm on the mailing list, sometimes I won't know that there was a meeting. There's been diagrams, we've been able to put in our input about what we want to see in the park, but that I don't think the community knows about this. So before we end this, I need to know that everyone that's on here knows about and is involved in what they want to see in the park, what new is going to change in the park. Is there some way that we can go to look, or is there some way you can get everybody's email address or something? But we need to be notified of what goes on and the changes and things that are happening in the park. Thank you.
Christine, if I'm not mistaken, we probably do have people's email addresses who signed up for this session. And I think, Lauren, I think you're referring to the community action plan, the Franklin Park action plan, which there is a website. Let me find it. I'll put it in the chat. I know that their sort of glossy recommendation that they've been putting together isn't out yet, but I think it's supposed to be out soon. That's supposed to be like an overview plan, the result of those meetings that you're referring to, of which there's supposed to be then additional meetings about how to actually implement it. Let me put that in the chat, but yes, to the extent that, and those are the city that's hosted that, we've helped them get the word out, but you know, we'll make sure we keep communicating about that, because that action plan is one of the most important things for the future of Franklin Park going on right now.
Thank you, Mike. We're going to continue. I think it's Ruthie Lejeune. I'm reading from 2 computers, so I apologize. But you're up next. Oh.
Thank you. I was just, I was just on. Hi, everyone. Ruthie Lejeune, Boston City Councilor at Large. Really appreciate hearing all the community input. Really been listening to a lot of the comment, but I just wanted, someone had asked about Long Island, and Tanya spoke to it too. I just wanted folks to know that city councilors a few weeks ago, we all went to Long Island just to think about like how quickly can we get this back up, because we know that it was a place that provided services to folks who were suffering from, you know, chronic homelessness, mental health issues, and addiction, and how much of a safe space it created for folks. When we talk about, you know, it was really one of the things that you see about Mass and Cass is it provided a space for folks to sort of exist without the judgment. And oftentimes that's necessary, that like lack of judgment is necessary for folks on the road to recovery. So we are doing everything we can on City Council to support the efforts to get Long Island back up and running as soon as possible and as quickly as possible. So just wanted folks to know that there's, you know, a lot of support from the City Council there to get the sort of housing and supports that we had back onto Long Island, because we know that it was such a critical resource and will help sort of take off a lot of the pressure that we're seeing in a lot of our neighborhoods because the Long Island isn't there. So just wanted to put that out there.
We appreciate you responding and giving us an update. Siddiqui Kambon, I hope I just unmute yourself. Thank you.
All right, how are you doing?
Good.
Yeah, just very quickly, let me just say that around the issue of safety and what's happening to Ms. McGuire and what's going on, you know, that we have internal responsibility too as a community as it pertains to safety in our streets and in the park. And so I just want to let folks know very quickly that the Black Community Information Center is sponsoring an emergency community security meeting for Black men on Thursday, November 3rd, 6:00 p.m. at the Nubian Library down there in Nubian Square at 149 Dudley Street. And it's not going to be a meeting to discuss the issues. It's going to be an action type meeting in terms of how we can get out here in the street and in terms of contributing to the overall safety as it pertains to our neighborhood. So we encourage folks to, men, to come on out. We got to do our job. So that's, like I said, 6:00, November 3rd, Library, Nubian Square, 149 Dudley, and let's get to work.
Brandy, there were two people that put their hands down. I just want to make sure. Al Curtis and Aisha.
Well, and I assume Lewis still would like to speak as well.
Yeah.
Oh, yes.
And Lewis at the end. So Aisha, you put your hand down. Aisha Miller, if you'd like to talk. I know you added some things in the chat. Okay.
No, I don't want to
Christine,
prolong
who's
the
the other
meeting.
person?
Okay.
Okay, thank you. We just wanted to make sure you got the opportunity to talk. Christine, who's the other person?
Was Al Curtis from Stony Brook neighborhood. I don't know if, yeah, you're still on, I think. Al Curtis.
Sorry, I was having trouble unmuting. But I'm Al. Can you hear me now?
Sure.
Yes, we can.
Okay, I'm Al Curtis Clark, and I am on the steering committee for the Stony Brook Neighborhood Association. And so much has been said this evening. I just want to kind of circle back to the fact that this meeting I thought was going to focus on safety in Franklin Park. And I wanted to make sure that some of the comments that I saw in the chat are really addressed. Simple things. I mean, the Reverend made it quite clear that if we do simple things to start with and those things, and then we can build on this. I know we don't have a whole lot of time, but you know what? What is a whole lot of time and what is a short amount of time? I can't tell you that. But things like what I'm thinking is lighting. Lighting is so important. And I know my lighting is a complicated issue. It's a very expensive issue, but it is a very, very important and necessary issue. The other thing that we've talked about just a little bit is the prominence of the police presence. I live in the Stony Brook neighborhood and I use the Williams Gate entrance. It is so dark over there and I never, ever, ever see police presence over there, ever. So, you know, these are things that we can address pretty much immediately that will give us some kind of leverage for the other items that we have discussed this evening. So thank you for listening for that little few seconds of things. Let's talk about lighting. Let's talk about police. Let's talk about safety. I want to feel safe. Thank you.
Thank you so much.
Christine, I think that was our last question. Oh, we have a Dorothy Fernelli who just put her hand.
Can you hear me? Can you hear me okay?
Louise, I'll make sure you're all set. We got you. Go ahead.
Okay,
These will be-
real quick. My question is about events. We use the park. I'm on the phone, please, 1 second. We use the park every day. We've been there. We've been around 20 years, and I'm glad to see people in the park. But I feel like if there was more activities that were planned that got people there, I think that could go a long way to help with the safety aspect. I agree with the previous neighbor down about lighting. The lights around the stadium, which is by the side where we live, flicker. They come in, they come out, bulbs need to be replaced. But I do want to say thanks. I'll probably miss some people or organizations, but thanks to all the organizations who are currently doing regular programming. I think it's, I just think it's great. And I think it brings people, and I know that we need to address the issues of substance abuse and our in-house neighbors, but I feel like when a space is empty, it might seem to be a place where no one's sort of watching you. So that's my comment, and I will take myself off.
Dorothy, thank you for your suggestion. Next, Louise, you're back up. Louis, you're back up.
Thank you, and I appreciate you accommodating me coming back to this process. First, I want to thank the Franklin Park Coalition for pulling folks together to have this discussion. This is long overdue. I want to remind people, when establishing the Franklin Park Coalition 44 years ago, one of the things that we had in mind, Alma Lewis, myself, and Matthew Good, and a number of other residents in Roxbury and Jamaica Plain, it was that the park wasn't being maintained. That Kevin White and then Ray Flynn, they didn't have any real commitment to Franklin Park. And it was the community, it was the neighbors and friends that made Franklin Park work, sustain it, that got the grants to fix up the golf course and work with the Boston Zoological Society at the time to make sure that we were able to maintain this beautiful treasure, this emerald, basically the jewel, the center jewel of the emerald necklace. It was the community. So it will be the community that will have to take an active role in making sure this park is able to live out its goal and its objective, which is to become a place of comfort and safety. I've raised 4 daughters here. Yeah, there are issues of care and concern and safety all the time, but it's a park. It's 480 acres. And that while lighting is necessary for certain parts of the park and call boxes, and rest stations and water stations, the idea is that at certain time of the evening, you really shouldn't be in the interior of the park because there isn't much that can be done for you because it's not designed for that purpose. But for areas around White Stadium and other places, I think that, better lighting will have something to do for early walkers and late walkers. But let's be clear. There has to be a better commitment and understanding of what Franklin Park is. It was never supposed to be a hangout for people in treatment. It should be a place for people in treatment to go in order to find the same thing everyone else finds, which is a respite and a place to find comfort and a place to download their concerns. But it's not supposed to be a hangout, and it should not be a dumping place for challenges that the city doesn't want to deal with directly. The state has a number of facilities that they could move people to if they were really concerned. If Baker really cared about the people on Mass and Cass, 60% of them who do not come from the city of Boston, we have a number of state facilities available. And let's be clear, the CAB, the advisory group for the Shattuck Hospital, never recommended it more than 110 beds. The only group that came in with a response to the RFP are the same people who created Mass and Cass. That the City of Boston Public Health Hospital was the one that created the situation there when they closed the satellite methadone maintenance programs in the various communities. Because I ran the Blue Hill Avenue drug treatment facility, I know that when they started taking all the clients into Boston City Hospital, they created the atmosphere. And that's why I'm not feeling very confident that they have a way forward. We have to deal with our neighbors and friends, our family members who have challenges, but we can't dump any issue into the park and not give the support and protection that it needs. No one has ever put a species into another environment and without monitoring and supporting that species to see how that would affect those that are already there. Franklin Park works for all of us. It has for me for 50 years. And I'm saying it can be. And I'm challenged the Franklin Park Coalition to do what you used to do and what you sometimes do. You bring us entertainment, you bring us joy, but you're also going to have to bring the heat to the city and the agencies that's supposed to protect the park and clean the park. And let me tell you, crime only happens with opportunity. And when you have overgrowth and dead trees and areas that people could camp and hide in, you've made it more difficult for people to be safe in Franklin Park. And therefore, I'm going to still work with you, Garrison Trotter, and the other groups in the community. We're going to work with you, but we have to work to make sure Franklin Park works for everyone. And that includes the police and the state police and the park rangers and everyone doing their job. Thank you.
Louis, thank you. We have one more question. Councilor Mahiga, we're going to close out with you. You were the last hand up. Councilor, are you there?
Yes, I'm here. Thank you. And Brandy, good job facilitating, and I'm encouraged to know that, this is not just the one and done. And oftentimes we come into so many spaces and places and there's always conflict, and we're so used to always being in that fight, right? And I think that if there's an opportunity for us to seize of what real community collaboration looks like, let's lean into this as an opportunity for us to change the way we do business, right? So there were over 200 people that showed up to this call, many of which, had really great ideas. And I think now it's an opportunity for those folks who are supposed to be listening to community to really take in what they heard here, and then in a good faith effort, come back with some adjustments, right? And some response to community, because that usually is where we end up missing the boat, is that we bring people to a space and then we forget about them. And so let's not do that this time around. And that one last thing that I will say is that when the fireworks were happening here in the city of Boston, there was two different opposing views. Some folks wanted to lock up the folks who were doing the fireworks. Other people wanted to find alternatives to that. The same thing that happened with the dirt bike riders. And so one of the things that our office did is that we brought people together across their differences and found some middle ground. And I think that this is what this moment is calling for, is for us to really look at this and bring all of the stakeholders, including those folks who are not here, that should be in this conversation, and creating space for folks who are living these realities right now to be a part of the solution. So I just wanted to come on and say that I was listening and I appreciate it. And I look forward to some really solid next steps. Thank you.
Thank you.
Thank you. I want to say thank you. I'm going to turn the Zoom over back to Christine, as well as to Ricky and Michael. Thank you guys for all of your suggestions, your time, and may we all continue to walk the park so there is presence and not have fear in the community we live in. Thank you.
Great. Thank you, Brandy. Go ahead, Ricky.
Yeah, good night. And I want to thank Brandy and Mike and Christine for all their hard work in trying to pull this together. I thank the community for all of your comments. We were listening, we do care. And when we saw our public servant, Jean McGuire, who's done so much for the city and the children of the city and state, get attacked like that, we knew we had to do something. But a conversation, as most people have said, is just the first step. The work still needs to be done. We still need all of you behind us, because we had enough people on this call tonight to shut down City Hall. And as Frederick Douglass once said, power concedes nothing except upon demand, not on discussion, on demand. So we need to work together, try to come up with some plans, like the Councilor Mejia said. This is where we drop the ball. We have a nice conversation, everybody feels good, have their say, and then nothing gets done. So we need to come together and come up with some strategies and actions to get these things done. So I hope that this is just the first step, and we'll have more conversations and create more committees and bring truth to power in the future. So thank you for your time. And we'll continue to try to pull these conversations together, but also I like to see the action in the work. One of the things that struck me was a young lady who said, why does everything have to be concentrated in communities of color? I would make a correction to that. Everything except jobs and contracts, because we're not getting our contracts. And we don't get our contracts in the park. When I saw them building the little houses, it wasn't a single person of color building those houses. And so we have more than just drugs to talk about. You know, my mother always said money talks. We need to know where the money's going. And if we follow the money, I think we can make some things happen. So thank you for coming out, and we will try to stay on the case, and hopefully you'll hold us accountable, and we'll be able to all work together to try to bring some change and make this park the kind of park we'd like to see. Good night.
Great. Thanks so much. Good night, everybody.
Good night, everyone. Have a great evening and thank you.
Oh God, do this. Oh, oh dear. Oh. How do we do this? Um, oh, um, that system. Oh. Mm. Oh. Oh. Oh, so it works.